This video will cover primary DLBCL of the CNS. Okay, here we go with another basilisk scene. By now, we should have an easy time remembering that basilisk represents DLBCL, since there are two previous videos explaining this. If you haven't watched those, I'd recommend it. Now that we've anchored ourselves to DLBCL, we need something to help us remember the CNS. And what better way to remember that than this character here with an unusually large head. His unusually large head will represent CNS. Another thing to remember with this character is his age. The median age for these tumors is 60 years. Moving on, these tumors are supratentorial and usually in either the frontal, temporal, or parietal lobes. To represent these lobes, we have the character wearing a hat. And wouldn't you say that the hat covers all the lobes except for the occipital? That's what we'll use to remember this. By default then, we can also remember supratentorial since all the lobes are supratentorial. These tumors can be solitary or multifocal. Solitary is represented by this one large bucket here. And you see all the other buckets around it? Those represent multifocal. I've always thought that the smallest and friendliest looking animals are the bravest. Seems to be the case here because look at this little prairie dog not phased at all. The prairie dog, in addition to this puddle it's standing next to, have a special meaning. They represent the fact that neoplastic cells of this tumor are usually found in perivascular cuffs. Peri sounds like prairie, and vascular is represented by the puddle since vessels have liquid in them. Next important fact to remember is that these tumors usually express MUM1. This, of course, is represented by this mother here. As in other videos, CD10 is represented by this den here. But this den is not full of CDs, as in other videos that represent positive CD10. So, this empty den represents negative CD10. Many cases demonstrate a BCL6 rearrangement and overexpress BCL6. This is represented by this pile of belts here. But notice that these belts seem to be made of sticks, or at least there are a bunch of sticks in between them. BCL is represented by buckle, which of course belts have. And 6 is represented by all these sticks, since sticks sounds like 6. The next point to remember is that these tumors may present or recur as intraocular lymphoma. Just take a look at this character's stylish green sunglasses. Remember that lymph things are usually represented with a green color, and to represent intraocular, of course, we have sunglasses. Okay, last thing to remember is that these tumors can mimic GBM radiologically. We will remember this by the fact that there is some type of explosion or blasting happening here, and stars are shooting from it. As you know, astrocytes are the cells implicated in GBM, and since astro means star, this is what we'll use to remember this tumor mimicking GBM. If you want to take it a step further, use the fact that the character here is wearing eye protection, just like radiologists do in their dark and depressing rooms. Pathology is where it's at. Sorry, rad bros.